So this is a video about coping in early labour at home. We know from the evidence that we have that the best place to be in early labour for most people is at home. So this is ways to cope with that, what's going on in your body, and ways that you can make it as easy as possible. We've got several things that are going on in the body. I'm going to use a balloon to demonstrate what's happening. So the balloon here is to represent the uterus. And there is a ping pong ball just at the base here, which is representing the baby's head putting pressure on the cervix, which is represented here by the end of the balloon. The uterus is a large muscle and it's got lots of muscles intertwined going across and going down. And they're working together for the first time with your first baby to try and push your baby down onto the cervix and get the cervix to thin out. When you're not in labour, your cervix is tucked behind your baby's head. It's quite thick and it's long and it will be closed tightly shut. This balloon is to try and demonstrate that. And when your body is starting to prepare for the process of labour, you might experience some Braxton Hicks contractions, which are tightenings of the muscles of the uterus. So when those are happening, as you can see, there's not a huge amount happening to the cervix. It's staying long, it's staying thick, and it's staying closed. What starts to happen when your body goes into the early stages of labour and the contractions are getting more powerful is that the contraction is coming from the top of the uterus. And as it squeezes down, your baby's head is pushed onto your cervix and the cervix starts to get a little bit thinner and it starts to shorten. And the contractions at this point are usually quite irregular, so they can vary in how long they are, they can vary in how powerful they are, and they can vary in how often they're coming. So you might find that you can have one every 5 minutes, one every 10 minutes, one every 20 minutes, and they can vary in how powerful they're coming, from really intense where you can't speak through them at all to being quite mild and you can have a little chat. It's really variable for each person. So sometimes people will really not feel this early stage particularly, and they'll feel like the contractions get regular and strong every single time. But for most people with their first baby, you're going to experience this for at least a few hours, and for some people it can last for quite a few days. So as you can see, the cervix is really starting to thin out now, and it's starting to get a lot shorter. And as we said, this process can take quite a long time. So staying at home, staying relaxed and comfortable will help this process to happen as quickly as your body's ready to make it happen. Okay, so we're getting to the point where the cervix is really thinned out and eventually it gets to as thin as a little bit of paper. And we now need the more powerful contractions to start the cervix to dilate. And then usually once we get to this point, we're heading towards about 3 or 4 centimetres dilated. So again, they can still be quite irregular at this point, up to about 4 centimetres dilated. And from that point on, you'll find that they get more regular and frequent and strong. So contractions and surges are both referring to the same process in labour where the uterus muscles are tightening and then releasing, but surge is used to try and make that more of a positive sensation of the power and intensity that might be experienced rather than thinking about it in a painful way. You can use whichever terminology you feel is most appropriate for you, and your midwife will try and use that terminology with you as well. Generally speaking, Braxton Hicks contractions are practice contractions, so the uterus is warming up, it's getting ready to start the labour process. For most people, they experience them as a tightness, so that the tummy goes really tight when you feel it, a little bit like the tightness of a drum if you were to feel the top of a drum. But when that tightness occurs, it doesn't seem to be painful for most people. It can be quite a strong sensation that eases off after, could be a few seconds, could be a few minutes, but it's not generally experienced to be a really strong, painful sensation. It's usually just an uncomfortable sensation. And they can come and go throughout the day. A lot of people experiencing them more strongly in the evenings, particularly as the pregnancy progresses towards the last few weeks and last few days before labour begins. When your body starts to go into the early labour process, you'll find that you'll feel the sensation usually a bit differently. So the tightness will still occur, but it will probably be much stronger, and you may feel it as more of a painful sensation than you have done compared to your Braxton Hicks contractions. And they will tend to build up. So we talked that they're going to get longer, they're going to get stronger, but in the early stages they can vary quite significantly in how long they last, how often that they occur, and how strongly you feel them. When you get towards the labour, so what we call active labour or established labour, then you'll find that the contractions come in a really regular pattern. So every 2 or 3 minutes, they're lasting a really good long time, around about 60 seconds, and they're consistently strong. So rather than some of them being able to, you can talk through them, you can move about, you can do, other things whilst having a contraction or a surge. When you get into the active stage of labour, your body's going to make you stop, focus, and give every bit of attention to that contraction until it has gone off. And that will take you having to breathe through it until it has released. And as I say, about 60 seconds for most people. If they've been in that pattern, so every 2 or 3 minutes, lasting a minute, and really powerful and strong every time for about an hour, that's usually a really good sign that that is going to be going into active labour with your first baby. Second babies can be quite different. They often go through the process of labour much more quickly. You can still have that early stage of labour lasting several hours, even a couple of days, but once it starts to change towards active labour, that can go much more quickly. So for people having their second, third, fourth babies, we'll usually say maybe wait till they're about every 4-5 minutes and they're nice and strong, nice and long, but come in that little bit earlier because things could progress much more quickly. With a first baby, for the majority of people, they'll need to be in that pattern for about an hour of every 2 or 3 minutes lasting a minute to really show that that labour is getting into the established part. So we would usually say in the early part, it's best to not really focus on timing them too much until the point where your partner's saying, I really think there's something going on here. I'd like to know how quickly they're coming. They seem to be quite frequent now and building up. At that point, you can either just write them down, you can use apps on your phone, but it really doesn't matter as long as you have an idea that over an hour period, how many contractions are coming in every 10 minutes, how long that they're lasting, and you could note down if your partner's able to talk through some or not others, or if all of them are taking all of her focus. And when you come in, or whether you talk to the midwives on the phone first, you're going to be able to tell us the pattern for the last hour, and that will give us a really good idea of what's been happening and whereabouts your labour might be, and that will help us to be able to guide you. Is it time to come in, or are you able to stay at home a little bit longer? And we really would like to talk to you because we're going to gain a lot of information by how you're breathing, and we can hear contractions over the phone. We'll get you to stay on the line with us. Your behaviour, your reaction to them, whether you're able to talk to us, that's going to give us so much information that we can guide you then about what stage your labour might be in and how we can help you going forward. Babies like to descend down into the pelvis on the side, and that's because the shape of the pelvis, if I show you here, fits with the baby going into the pelvis in this direction. And then as they get lower into the pelvis, which is caused by the contractions coming, and these early labour contractions are pushing your baby down deeper into the pelvis and getting their head to push down on the cervix and thin it and start to push it out the way. And then as the labour progresses, we like the baby to turn round and come further down into the birth canal. If your baby is in a slightly more uncomfortable position of being back to back, which you might have heard that term, and it's when the baby's back is on the mum's back, and I'll just show you the bones in the back here, you might experience a lot of your early labour and even into active labour in your back. For a lot of ladies, if the baby's in the ideal position with their back at the front, then you're going to feel the sensation of the contractions in the lower tummy, but you may still feel them in the hips and in the back as well. But if you've got it all in your back, it may be that your baby is in this back-to-back position, and as you can see, it's much harder for your baby to fit nice and snugly into the pelvis and nicely onto the cervix. So it's a slightly less ideal position, and we'll just we will encourage you to try and turn your baby round into that slightly better position, just to make your labour as easy as possible. Ladies whose babies are in a back-to-back position in labour can find that the early stage particularly is quite prolonged because their body's really trying hard to get their baby to rotate and bring the back round to the front. You can find that out in late pregnancy as well, so your midwife can feel your tummy and feel whereabouts your baby's back is, and if we know that your baby's in a back-to-back position in late pregnancy, we can guide you with some exercises to rotate your baby first, and that will make the process easier. But if your baby is in a back-to-back position in labour, don't worry, there are things that you can do to encourage your baby to rotate and come down. So you might find that you've got several hours where the contractions are coming or going in that irregular pattern that we've described, and then they go off for a few hours. If that happens, please don't worry, it's completely normal, and we would say just enjoy that rest period. Your body is usually just trying to signal to you, I'm not quite ready to take this to the next stage yet. So go to bed, particularly on your left side is good because that helps your baby to get into that ideal position for carrying on the labour, and it will also help you just to be as comfortable as possible to get some sleep. When your body is ready, it will take it back to the next level of regular and strong contractions. If your body's exhausted, it's not going to be able to do that, so it's really, really important to think about resting first. You can be upright and mobile once you've had a good rest, but rest in early labour is one of the most important things that we advise. Your body is using the same amount of energy, whether it's a long or a short labour, it's the same amount of energy as running a marathon. So there's no way you'd run the London Marathon on half a cereal bar and half a glass of water. You would be thinking about lots of protein, lots of carbohydrates, giving your body that energy store so that when you're running the marathon, you've got enough reserves there to use that with all these contractions that your body's going to have to cope with. So it's really, really important that even if you don't feel like it, even if you're feeling nauseous, that you really try and eat and drink as much as you can. Little and often is fine. But if you're starting to get signs that early labour is about to start, then it might be a good idea at that point to have a bowl of pasta with some chicken or some corn, something that you know has got high carbohydrate, high protein content that's going to give you that energy. And then once you're into the early labour process, you're starting to feel less like eating and drinking, just sipping. Isotonic drinks are fantastic. Water, squash, juice, whatever you want, it doesn't matter as long as you're hydrating. And then little snacks, you can try toast, you can have sweets, you can have whatever you fancy, but little things that you can just pick up and eat between the surges or between the contractions. So a lot of ladies do feel sick in labour, and some ladies will vomit during the labour process. It's okay as long as you are then able to eat and drink again. If you're continuously vomiting and not able to keep anything down, we would encourage you to phone in and talk to us. It may be that you need to come in and have an assessment and just see if we need to give you some medication to get that vomiting under control. If it's just once or twice and you are then able to eat and drink enough to keep your energy up, then it's very normal, and we would say just continue. It's usually just due to the hormones that are reacting in the body to get you into labour and keep you in labour, and also the strong sensations that you're feeling can often give nausea and vomiting. So it's really important in labour that you keep your bladder empty. Your baby is right next to your bladder during the pregnancy and during the labour process. If your bladder is full, it's going to stop your baby coming down as quickly as they would ideally do. And it also may damage your bladder if your bladder is very full and your baby is constantly pushing against it. It could cause some nerve damage there and give you long-term problems, and that's not what we want for you. So we would like you to keep your bladder empty by going to the toilet every couple of hours, more if you need to, but certainly every couple of hours going to try and empty your bladder. It may be a little bit uncomfortable as your labour progresses and your baby gets lower, and you may find that you need to sit for a few minutes on the toilet, and some people find it helpful to just rock back and forward a little bit just to try and push past the baby's head if your baby is very low in your pelvis. But it's important to keep drinking and emptying your bladder frequently. So it's really common in the early stages of labour for you to experience some loose stools, and that's because the uterus, as it's contracting, irritates the bowel and just makes your body have a little bit of a clear out, and that's completely normal. As long as you feel, again, well in yourself, not feeling unwell in any way, then it's just part of the process and it's nothing to be concerned about. So a show is a substance that's a mucousy substance. It sits inside the neck of the womb or the cervix, and when you start to have changes in the cervix, so if you're having Braxton Hicks, you might find that the show is released and it's the mucus plug coming away. It looks like a snotty mucousy substance. It doesn't look particularly nice. It can be streaked with blood, it can be white, it can be brown, and it's completely normal. It's just part of the process of the body changing, getting ready to go into labour. It's not a strong sign that labour is imminent, but you may find it is accompanied by contractions as well. We don't need to know about it unless you feel that it's actually red, fresh bleeding that's coming from the vagina. But if it's just the mucus on wiping or on a pad and it's streaked with fresh red blood, that's okay. It's perfectly normal and nothing to be concerned about. If you think the bleeding is heavy, red, fresh, it's on a pad, it's on wiping, it's running down your legs, that's different. That could be a concern, and we would like you to phone in straight away and talk to a midwife. So waters breaking is different. That's the sac that is around your baby bursting, and that can be either from behind your baby if they've kicked a hole at the top of the sac and the water is running down the uterus and out of the cervix through the vagina, or it can be the bag of water that sits in front of your baby's head as your baby has descended down into the pelvis. You might find that you get trickling of water and that you have pads that become wet over the day. So we usually encourage at late pregnancy, you can have an increase in vaginal discharge and need to wear a panty liner. If that panty liner is becoming wet rather than a little bit damp with discharge, then we would encourage you to phone in. If you have a large gush of water, when you're sitting, lying down, moving around, you suddenly feel a big gush of fluid, again, that's another way that your waters can break, and we would again want to know about that. So if you think your waters may have gone, call into the unit straight away and talk to a midwife, and we'll encourage you to come in for an assessment. So they should be a nice clear or slightly yellow tinge, we call it straw coloured in the waters. If there's any other colour, if they are green or brown stained, we would like you to call in straight away and tell us that. It could be that your baby has passed their first stool, it's called meconium, into the waters inside, and that would be a reason for you to come in and be monitored more closely. If the water is clear, if it's even a little bit pinky stained, then that's completely normal. We'd still want you to come in for an assessment, but you wouldn't usually need further monitoring if everything was fine on that assessment with the midwife when you came in. So a TENS machine is a drug-free form of pain relief that can be used throughout labour. It's best started in the early stages of labour, but it can be used throughout labour. It works by the pads transmit small electrical pulses up through the nerves of the spine that run either side. It increases your natural endorphins, which are your painkillers, and it also helps you to be distracted a little bit from the sensations that you're feeling by interrupting the pain pathway that's between the uterus and the brain. Paracetamol can be helpful in early labour. You can take 2 paracetamol tablets every 4 hours to a maximum of 4 times over a 24-hour period. Oxytocin is a hormone that is really important in labour. It's the hormone that gets you to start labour and it keeps your labour going. The most important way that you can help to stimulate oxytocin is by keeping your environment as calm and relaxed as possible. You can do this by keeping the lighting low, perhaps some candles. You can try and keep some nice music going in the background. You can put on a film or a TV programme that will distract you and make you laugh. That will all help to keep your oxytocin levels high and encourage your labour to progress. The birth partner's role is really important in early labour. You're going to be the one who's able to keep your partner calm and relaxed, and this will really help her labour progress. Keep encouraging her to eat and drink. Keep encouraging her to regularly go to the toilet. Keep her as calm and relaxed as you can. You can offer back massages, hand massages, but do bear in mind that some women don't like to be touched in labour, so if she asks you to stop, then just abide by her wishes. Look after yourself in labour as well. It's really important that you keep yourself hydrated and keep eating, because you're going to need your energy to keep supporting her throughout the labour process. If your contractions space out, use this time to really rest. Lean over the pillows that you have supporting you, go to bed and get tucked up, and just try and keep yourself really, really comfortable and try and sleep where you can. Some women experience their labour pains in their back some in their front, some in their hips. If you're feeling that discomfort, then you might find it soothing to try a hot water bottle or a warm compress like a wheat bag warmed in a microwave, just laid against where you're feeling that discomfort most, and it can be really soothing. Warm water can also be really soothing and relaxing in early labour. So if you have one, try and run a warm, deep bath, and you can relax into the water for as long as you feel comfortable. You may find that sitting or lying on your back in the bath is not very comfortable, but if you tip slightly over onto your left or your right side, you'll be able to submerge your bump under, and that will be more soothing. So this position is ideal at all stages of labour, but particularly if we're trying to help the baby to rotate in the pelvis to come round to that ideal position where the back is at the front, and also trying to keep the pelvis open so that there's as much space as possible for the baby to come down. If Catherine was sitting upright, there would be less space for the baby to come down. As soon as she's tipping forward, there's a lot more space here. This lower part of the back, the coccyx, can lift up and make as much outlet as possible for this baby to come down. Also in this position, the heaviest parts of the baby are their head and their back. So by tipping forward, the baby is much more likely to rotate round and come to the front so that it's in a much better tucked in position and able to descend down into the pelvis. So some very simple massage techniques that we can show you for birth partners to do at home, which will help mum to stay relaxed and keep her breathing nice and calm and controlled. If mum is experiencing a lot of lower back pain, then a really soothing massage to help is that during a surge or contraction, if you use the heel of your hand, just pop it against the sacrum right at the base of the back and just give a little bit of counter pressure, because what mum may be feeling is that lower part of the back, the coccyx, being pushed up by the baby. So to push back against it can be quite soothing and relieving. The other thing that you can do is what we call a light touch massage. These can be done either between contractions or with contractions. It's completely up to how the mum is feeling. So by doing a light touch massage, if you go to the top of the back and then just gently press down as mum breathes out, and then you just want to do figure of 8, very, very lightly, just down the back. Try and keep continuous contact with mum's skin or over her clothes, depending on what she prefers. It'll be much more soothing. It's quite common in labour that ladies can feel a little bit tense and can start to breathe quite quickly when they're trying to manage the sensation of a contraction. So by encouraging her to take deep breaths through her nose and slowly out her mouth, she'll find it much easier to manage the pain. So just say, Catherine, nice deep breath in through your nose for me, and then try and blow out through your mouth. Soft, open mouth. Breathe and slow that breath down. And just keep reminding her, nice, deep, slow breaths. Drop those shoulders. Try and keep that breath really slow and really deep. Well done. Deep breaths in and out. Sometimes it helps to count, so you can ask her to breathe in for 3 and then out for 8. So breathe in through your nose, 1, 2 and 3, and then release, 1, 2, 3, 4, 5, 6, 7, 8. If you've rested and you're keen to get your labour to progress, it can be helpful to go up and down the staircase sideways. This will help to tip your pelvis and encourage your baby to descend lower. If you have rested previously, you've tried the stairs, needing a change of scene, it can be helpful to go outside and go for a walk in the fresh air. So we'd like you to call in when your contractions are 3 every 10 minutes, they're lasting at least a minute, and they're really strong and powerful every time. If they've been in that pattern for an hour, that's a good sign that your labour is established, and we'd like you to call in. We'd also like you to call if your waters break or you suspect your waters have broken, and we'll invite you in for an assessment. If you have reduced movements from your baby at any time, or you're concerned that your movements have changed in pattern, we'd like you to phone in immediately. If you have fresh red bleeding from the vagina that's not accompanied by sticky mucus, we would like you to call in. If you feel unwell at any time or have any concerns about yourself or your baby, need further advice, you can call us anytime, 24 hours a day, you'll be able to speak to a midwife. If you're not coping at home with the contractions, if you need some advice on what to do, or you just feel that you need an assessment from a midwife, you will always be welcome to come into the hospital. If after assessment you and your baby are well and you're feeling better and able to go home, we will encourage you to do so, because we know that the early stage of labour for most people will go more smoothly and efficiently at home.